Hi, Dr. Del Grosso, SF Chiropractic. I just spoke briefly a little while ago about problems with the neck and problems with the curvature in the neck and issues with the neck. Related to that, I want to talk a little bit about something that affects children. A lot of them, actually probably 2 or 3 children out of 25 are affected by this, and it's ADD or ADHD. The difference between the two is ADD is where there's kind of a slowing attention deficit, and ADHD is where there's a deficit, but there's also hyperactivity involved. Okay, if we look at the brain, 90% of the time the problem with ADD or ADHD is a right brain issue, is problems with the right brain. And if you look at your brain, left brain is like the accelerator in your car, is like the gas pedal. Right brain is like the brake, and there should be good balance between those two. When you have a problem with right brain, what happens is it slows things down and you lose that focus, that concentration, or there's a huge imbalance which causes the hyperactivity. Okay, there's quite a few things we can do to work on that. One of the causes, or there's a lot of theory on the causes, but one of the things can be a problem with the curve, which puts a lot of extra pressure on the neck, especially the areas of occiput C1, C1, C2, which is a real trigger area because there's so many ganglion, there's so much there. That's where the brainstem is at that level there. The other thing is diet, which is very important. A lot of people say it's genetic. Well, it's only genetic because usually the genetic part of it is because of allergy sensitivity or something most of the time. Okay, so there is a genetic component to it. And the other thing is lifestyle. Some kids that play video games too often or do something that stimulates left brain but not, so there can be different things, but all these things we can address. We can work on diet, we can see if there's a problem, we can see if there's a problem with gluten or something in the diet, we can change the diet, we can add supplement, we can try to restore the curve, make some changes in the curve, and we can also work at the cognitive part to try to strengthen right brain and get better balance in there. So please, if you have a child's ADD, ADHD, bring them in, let us take a look. Let's talk about it. Let's see what we can do. Thank you and have a great day.